Snapshotting as a technique to improve our osteopathic treatment. And regardless of whether you're a cranial osteopath or you prefer a more structural approach to osteopathy, what I'm going to teach you in this video is going to really help you improve the results for your patients. Now, the name snapshotting comes from the idea of a camera. We hold up a camera, snap, take a picture. Look at something else, take a picture. We think of that in terms of the brain. We can do something similar. If I say to you lymphatics, if I say to you artery, if I say to you leg, with those different words, different images will flash up in your mind. And so if you close your eyes with your patient, you can change your focus. Without moving your hands, you can think feet and your intention can go there. Cranium, your intention can go there. And so there's different parts of the body that we can put our focus on. However, that's not the way I want to use snapshotting in this particular video. Instead, we're going to use snapshotting to focus on different systems within the body. For example, lymphatics, artery, venous structure. Now we can do that in a global sense. So if I said to you now, close your eyes and think lymphatics, an image comes up for you. Now keep your eyes open now, and if I say lymphatics to you again, with this image, you get a slightly different feel for it. We're thinking of lymphatics in the whole of the body because they are continuous. Of course they are. Now if we switch and we say arterial system, again there's that continuity. Now, we can go a little bit deeper and think arterial system, let's get that heart pumping and let's think about the blood moving through all of that arterial structure. There's a pressure to it. And now if we think venous structures, again we have the structures here of the whole venous system throughout the body, but it's a slightly different thing because there isn't the pressure in there. It's a slightly different thing. And so we can switch our focus between these big systems. Nervous system. This is a really important one. If you've got a patient and they're really jazzed up in the nervous system, then you can start to focus on the nervous system and you'll feel a buzz in the nervous system. And then if you start to think, okay, with my focus there, can I just take the tone down a little bit? Can I just think of a little bit of air and a little bit of lightness rather than fire and the element of fire? Then you could start to work with someone's nervous system in a global way throughout their whole body. And so this is a beautiful way that we can do these different systems. We've got the arterial system, the venous system, the lymphatics, we've got the nervous system, but we also can think about other things like CSF. Maybe you want to think about the fascia and get into the continuity of the fascia. So all of these big systems. So this is one way that we can use this to really help with patients. Now if you like structural mechanical osteopathy, that might be a little bit like you think, well, that's a little bit global for me. So let's get the example of the neck. And we will use a specific example of a patient that I saw a while back. Now this patient that came in with neck pain, and I was trying to get to the bottom of what was going on with his neck pain, and they didn't really give me much of a history. It just came on, I was playing with the kids and it just came on. So we do the examination and all the way down the right side, the muscles are just so super tight. So when we came to treatment, I'm trying to free up this right side of his neck. And it's just not playing ball. No matter what technique I use, whether I go a little bit lighter than functional technique, whether I'm using METs, it's just refusing to budge. And so definitely there's something else going on. And this snapshotting was what got me in there. I put my hands on there, I closed my eyes, and I just visualized all of the muscles in the neck. Snapshot 1. Then I visualized all of the bones in the neck. Snapshot 2. I didn't get the change I wanted. I wanted to go deeper. So then I visualized all of the fascia. And then I moved on and I visualized the arterial system. I imagined in my brain what was happening with the arteries and the veins and how they come up, and there's that little kind of kink on that lower neck of the system, and then as we move up through the neck up to the top, C1, C2, occiput, how it again does that bend and goes up into the skull. And as I started to visualize that, suddenly I thought, oh, this is starting to respond. This is where the problem is. The problems are in the arteries and veins, which started to get me a bit worried, thinking, oh my God, is the guy going to have a stroke? Is there some sort of issue like that? And it also made me think, I'm glad I haven't HVT this person. So what happened though, as I started to wait a little bit more, I just said to him, I said, well, okay, let's dig into this a little bit more in the history. So you said you were playing with the kids. Tell me exactly what you were doing. And my hands are still on the neck, feeling what's going on. And he said, oh, well, we were just playing, I had the rugby ball, and we were just kicking the ball up in the air to my boy. I was kicking it up into the air, he was catching it, he was kicking it up, and I was catching it. And I'm thinking, okay, well, what's happening there? He's going to be tilting his neck back. And I said, okay, well, how many times you did that? So, probably 20 or 30 times. And then as I started to think about what was happening with him tilting his neck back to look, because you've got to tilt the neck back to look upwards to make sure the ball doesn't land on your head to catch it. And so as I was thinking about this, the neck started to respond. And I suddenly realized, I had this insight, that what he was doing was this multiple repetitions of this C1 occiput extension in that area in order to look up, holding his neck in that position, and probably as the ball coming down, having to micro adjust to make sure that he gets that catch right, and then repeated doing this over and over again. And what had happened was it had caused trauma in that artery and venous structure up at the upper complex of the neck. The neck had got the repeated stretching of that area, and that whole area was inflamed with the nervous system input as well. And so whatever movements I did in the neck to try and free up the muscles was just causing more of an issue in that area and causing it to tighten and protect. Because it thought, my God, my arteries and my veins in that area are under threat, I'm going to lock down this neck. And so the snapshotting of that arterial structure allowed me an insight that I wouldn't have got otherwise. And then what happened, I went back and I did a functional release to kind of unwind through the neck, but with reference to that upper complex and of that C1 occiput on that extension. And when I had that as part of what we're doing, as part of the puzzle, part of the picture, then the body was like, oh, that you are going to take into account what happened at C1 occiput. And suddenly the technique that I was doing before that hadn't worked, now the neck started to soften and release. Now once you're in there, you're in the game, you're getting a little bit of slack, getting a little bit of release, then it doesn't really matter what technique you do after that, because you've got the slack in the system to use those techniques. So whether you want to go a little bit more structural on an MET, whether you want to go more cranial and soft, it doesn't matter. You've got that initial inroad, the system has accepted you, you've got the connection, you're going to get a successful treatment. But I want to really give that to you as a perfect example of how snapshotting works regardless of the type of technique you like to use. Regardless of that, gets you a different view. It's like standing to one side and seeing a different aspect of what's going on for the patient. And then when you do that, like change your conversation with someone, you loggerheads with someone, you're not getting anywhere, and you suddenly have an insight into where they're coming from, and you're able to change your viewpoint and see it a bit differently, and suddenly everything starts to soften. Suddenly you have a gap, and you're allowing that little bit of connection with the person, and the treatment then starts to go and starts to work nicely. So, two ways to use snapshotting. One is in that micro way there we talked about in a particular part. Doesn't have to be the neck, can be anywhere in the body. And the other one is a more systemic where you snapshot out the whole system. And that is really good for chronic pain patients, for patients that have had issues for a long time, systemic problems, whether they've got MS, ME, all sorts of different problems like that. It's very good for that because it allows you to kind of get a better, deeper connection with the patient and allow that self-healing mechanism to activate a bit more. Try to get a little bit of more juice going in the system, which is very good for those patients that are low on potency. If a patient is low on potency, then it's really difficult sometimes to get treatment with them because robust treatment just flares them up and they just, they get a bad reaction, or they simply just shut you down. It's too much, you're asking too much of the system. So with this more wider aspects of using this systemic snapshot, it's great for those type of patients. So I really encourage you, use this in the next person that you treat. You can do that without them even knowing, so it's not like suddenly we're having to change everything we do. You're just adding this little bit extra in, and it will open a doorway for you, and you will see greater riches, I think, in the patients that you treat. If you've enjoyed this video, please hit the like button and subscribe. There's plenty more on this channel, and you can check out the playlist here to see whether it's treating adults or whether it's treating babies. Lots of different footage on you to hopefully help you make a better difference for your patients.